All right. Well, it's noon. We are going to go ahead and get started. Welcome, everybody. We're going to have a really interesting conversation today, I have a feeling. So, my name is Tad Brinkerhoff. I'm the Associate Vice President for Grad and Online Programs. This is our Friday Career Connections that we host most Fridays. And really, the goal is couple of goals with what we do on Fridays at noon really is to get our online community together once a week and learn from people who have had successful careers, learn from them about what they've done to manage their careers, as well as get some insights into the industries. And so today our theme is healthcare consulting, healthcare and healthcare consulting. So we are very excited to have Cassandra Toscano, who is actually a sibling of Jonathan Early, who's a regular on our podcast. So, Jonathan, thanks for the introduction. I talked to Cassandra earlier, and this is going to be really fun. Before we hear from Cassandra and her story, her career story, if you would in the chat, just put very quickly where you're physically located, and if you're an SUU student, what program you're in. And if you're not an SUU student, that's fine too. But I'm just curious where physically you're located, and then what's your area of study, or maybe if you're working like the area that you worked in. I'm just going to want to see how many of your people are into healthcare. So we've got Natasha from Cedar City, grad online. Great. Thanks, Natasha, for sharing. Crew is in Cedar. Shiloh's in Saratoga Springs doing the MPA and working with the Division of Child and Family. Jones in St. George Healthcare Administration. Perfect. Jonathan is an MBA and MSBA. He's an overachiever, which is great. Amy at SUU with STEM. Oh, we've got someone for Virginia. That's great. Bob, and is doing his Master's in Professional Comm. Levi, MPA, working in healthcare careers. Spokane, Washington, CSA. That's the cybersecurity. Manhattan Beach Speedway program, which is a Bachelor's of General Studies. West Jordan, nursing. Great. Healthcare administration at Weber State, non-traditional. David, who we talked to, is, oh, you're signed up for the healthcare admin cert. Great. And Jared's in the geoscience building. He's doing his MBA in project management. Gary's in Logan, Utah, doing the MBA and healthcare administration. Well, great. Oh, this will be perfect. We've got some healthcare administration folks. So, all right. Thank you for sharing and thank you for making time to join us. Oh, we've got Becca is doing the MPA and works in athletic fundraising. So, all right. Well, I'm super excited to hear from Cassandra today about a really important topic. And I admire, we were talking earlier about, she grew up in Utah and then she decided to go to Boston and she went to Yale. And so I don't want to steal her thunder, but I'm just really impressed with her mindset and how she is willing to do things outside of her comfort zone. So, Cassandra, tell us about your journey to where you are today and why you made those decisions. And then I'm sure we'll get into more about the industry and where it's going. So,
Yeah, thank you for inviting me. I appreciate it. I'm always happy to talk about healthcare and talk about career journeys. They're always a journey. So I'm Cassandra Toscano. I currently live in West Hartford, Connecticut. I'm from Provo, Utah. I moved there in about third grade, and I started at Timpview High School and then finished at Brighton High School in Salt Lake City, and then moved to Boston to pursue biology and a pre-medical degree. So currently, I'm the CEO and co-founder of Health Transformation Advisory, which is a consulting company. I've also done consulting at PwC, and they have what's called like a talent exchange. So I will do consulting with other companies too if they need specific subject matter expertise. Just a little personally about me. So, I am a first generation college graduate. We had some associate degrees in the family, but I was the first full undergraduate degree, full 4-year undergraduate degree. That's not to say that we were a family that education was super important to the family. But just based on different opportunities, people didn't have, the opportunity to pursue a higher education. And so I think it's important if you're first gen to be really proud about that and everything that that takes to accomplish that. We're also Native American. So part Native American and our dad is from Texas. Mixed background, and there's a lot that kind of comes with our grandma being Native American and even how that was mixed with education. Because of the Indian residential school issues, there. Um, so I'm a mom. I have two kids, and I'm married again. I live in Connecticut. We were a military family, so we traveled all around, growing up. We settled in Utah, and when my folks separated, and that's why we grew up there. But I do recall, and I was telling Tad this, that I missed some diversity when I moved to Utah. I literally remember being an 8-year-old child and thinking, like, where did everybody go? And so, like, I missed just all kinds of people because had grown up in Japan, and then California. And so, there were a lot of similarities in Provo with everybody growing up there, which I loved. I still keep in touch with people there, but I was looking for a different adventure and looking to kind of expand. I'm glad we expand my experience. I'm glad we moved to Salt Lake the final 2 years because Salt Lake to me was like this big city. When we were growing up in Provo and I lived there for 2 years, I was like, this is it. And so I was like, I need to go somewhere else and try other things. And so I was looking at schools. Again, I wanted to be pre-med. I wanted a school that was really good in science. I wanted some place that was really diverse. My mom put me in the library at the bottom layer of BYU and was like, had all these textbooks and was like, pick a school. And so, I clearly got to the B's at Boston University and it checked all my boxes and I applied. I was really looking at either going into pre-medical or journalism at Columbia. At that time, it was a very different, but Columbia's in New York and I was afraid to go to New York. And so I ended up at BU and it was fantastic. It was a great place to go to school. If you haven't been to Boston, it's a great town. There's over 100 universities and colleges there. And so for a student, it was a great place to just be a sponge and learn about different ways of living and, different things. So my junior year of college, I decided not to go to medical school. I have grand mal epilepsy, and so I was really worried back then about how I would stay awake at night and it wouldn't trigger my seizures. And there were no rules on residency hours, at the time. So I just really had no idea how I was going to do this. I didn't really know how I was going to pay for medical school because I had some scholarship at BU, but I was really on loans. And I also just want to call out, I finished college in 5 years, and so there were some ups and downs, in our family. And I took a year off and went to community college for a year and then went back and finished my degree, so I just want to call out, like, there's all sorts of things that, like, life happens, and you keep going and you can continue to be a success. So I went back, I switched my junior year, finished all my pre-med requirements, but I just started taking as much finance and economic classes as I could, and I decided to go into healthcare business. I also was a medical assistant at the time, which was a great way to see the inner workings of clinics, the inner workings of hospitals. And I didn't really see that physicians were that happy. And so I was like, am I really going to take on $300,000 of debt or whatever it was going to be, and still not really have control of my atmosphere, right? And have things happen to me versus me helping shape the environment. So that's why I went into the business side. I was very lucky to be in Boston. So after school, I went to work in Partners Healthcare, which is there, and they own many of the hospitals there, including Mass General Hospital and Brigham and Women's Hospital. And I just started as a financial analyst. And I took my science education and my anatomy education, and I was a really good translator for the hospital administrators, the physicians, to the finance and contracting, cost accounting teams, and just like help them translate how to make money essentially out of their clinical services. So I did that for a number of years. And again, I was just a sponge. I did the best I could. I put a ton into that career. And then at a young age, I was given the opportunity to lead a department at Brigham and Women's Hospital. So I was 26 and maybe just young enough to be dumb. And so I said to them, "You guys have a bigger problem here than I can fix out in my other role. But if you made me a role, I could come here and work here full time and be your department administrator." So this was for the interventional radiology department. I was like, "You guys need a full-time business manager." And so it took 9 months, but I waited. I had other job opportunities during that time, but that's what I wanted to do. I wanted to lead. I wanted to jump out of just finance. I wanted to go into hospital operations. I wanted to know, be a little closer to the patient. Those were the things I was thinking through. I waited 9 months. They made the position for me, and I went over, and they let a 26-year-old lead interventional radiology at Brigham and Women's Hospital in Boston. And I just, got exposed to national associations. I led a fellowship program there. I really just said yes to all the opportunities, even if they weren't exactly what I was looking for. I never was looking to run a residency program. I loved running the operating rooms. That was my favorite. But over time, Brigham and Women's is one of the first hospitals in the nation where women delivered in the hospital. It had been there 200 years. So I kind of was thinking about, Brigham and Women's is going to be fine without me, is what I was kind of thinking. It's going to live on without me. What do I want to do with my career? And so, because it was a very all-consuming job to work in hospital operations, you sleep there during snowstorms, like that kind of thing. And so, I was thinking about, well, what I wanted to do next, and I really wanted to scale my impact. That's what I wanted to do. I really wanted to help more people for longer periods of time. Interventional radiology is operations, right? So you're in for an episode and you're out. I really wanted to take care of populations for a longer period of time, and like millions of people. And I got that experience through the National Association work that I had been doing, and I had been working with some CMS. I asked for a position, the Center for Medicaid and Medicare Service. I asked for one of my friends at the hospital, "Hey, I saw this regulatory thing come out. Can I write the opinion for this? And how I think what we should say back to Medicare?" And I just took that opportunity. They said, "Yeah, sure, try it." We weren't going to do it. And so I wrote that opinion back. I went and presented it in Baltimore to Medicare and Medicaid, and changed partly how some of the cardiovascular surgeries were paid for. So it was just trying things, asking for opportunities, learning from people. And so I was really confused whether I should go and do a master's in public health or whether I should do an MBA. So I took a minute. I went back to do my MBA when I was 30. And because it took me, a lot of people were just more sure than I was. And it was going to be a lot of money. And I wanted to go back to school full time because I really I worked two jobs during undergrad and all this stuff. So I really wanted to go back to a full-time MBA program and just study. And that was going to be expensive. And so I was deciding between MPH, MBA, or whether to do 2 degrees. You can see John's doing two. And so, but that was 3 years. That was going to be expensive. And so I decided to go towards MBA so that I would just have more flexible skills. That was really, I had been deep in clinical operations. And so I wanted to round out my business side a little bit more. And remember, I was pre-med, so I had a lot of science, before. So it was really about rounding out my skills. And so that's how I decided to go to business school. I did not think I could get into Yale. There was no part of me. There was a colleague that I worked with that said, "You should apply to Yale." And uh, uh, and I, she had gone to Yale School of Management, and she said, "You're just your essence and like how you think, and it's very, Yale, and I'll sponsor your application there." And so you can apply for free. And I was like, really? I was like, that's just silly. And so, I really just didn't think it was something that I could do. But she really encouraged me and she gave me the free application. And so I applied to Yale. I got into Yale for my business degree and they gave me a scholarship to go there. And I remember getting the phone call and I just like I thought it was a prank. You know what I mean? And so but I did try in my applications. Like I applied to top 10 schools. I got into a couple other schools. I didn't get into a bunch of schools. And but I'm so glad that I got into Yale because it did suit my personality quite well. It's more of a general management program. And so you don't have to take certain classes to like specialize and meet certain requirements. So once you get into a Yale grad program, you can take classes at anywhere in Yale University at any grad program. And so I took law school classes, I took public health classes. Um, I focused in business strategy. That was a focus, but they don't give specialized degrees. It's a general management degree. And I loved it. They taught classes that were cross perspective. So it would come from the customer perspective and also the regulatory perspective. It would come from the marketing perspective and the finance perspective. And so they do these cross perspective classes. And it just taught me how to think. And so I really loved it. Met my husband at Yale. And so it really did change my life. And then after Yale, this was 2009, and Obamacare was like coming out. And so I wanted to be involved in implementing something new in healthcare. I also had read a book called Redefining Healthcare by Michael Porter. So if you're in healthcare, you should read that book. And that was published in 2007. And so this shift was happening in healthcare of how do we help more people? How do we get through some of the blockades of getting, healthy things out there? And so I read that book and I went into population health. So I graduated, went into consulting. Again, I took assignments in consulting I didn't want to do. I did a lot of work for uh, Merck, which I wasn't really interested in pharma, but it gave me the idea to go evaluate other parts of the healthcare value chain. So I also did an internship at Boston Scientific to learn the medical device side of things and how they invest their money in research and how they do portfolio planning and things like that. It was super interesting. And then after I got out of healthcare consulting, in this country where you really do population health at scale at the time was managed care companies. And so it's insurance companies. People don't love insurance companies. But that's where actually on the clinical side of things, you can do these innovative care models that takes care of uh, uh, lots of people who are falling through the cracks and not showing up in office clinics. And so I was at Aetna, I was at Emblem Health, I was at Health First, which is a Medicaid company. I also decided to learn Medicare, Medicaid, commercial, self-insured. I was always trying to learn something I didn't know. And I was trying to understand it sort of in 3D from different perspectives. So when I jumped from job to job, it was to learn something better, and to take advantage of an opportunity that I was always looking for breadcrumbs of quality, is what I would say. Like, what's going to show up on my resume that rounds me out or that like shows up as like the stamp of quality that like maybe another candidate for a job's not going to have. And so I was just looking for those opportunities. And I was also always looking for like, what is the cutting edge right now? So that I'm an environment shaper. I like to shape my environment. And so I like to kind of work on the edge of things. And so, whether it's innovation, technology, new clinical care models, social determinants of health, there's always an edge of it. And I always want to like prove like what's working and what's not in that space. So that was the second chapter of my career. And then now this third chapter of my career is I founded my own company. I went around, I hired all of my old bosses who I loved to work for. And so they're my co-founders, and it's great to work with people who you love, who you respect. And they have the same mission that I have, which is to take some of the knowledge of what works in healthcare, take it out from behind the scenes of private companies and make it more available to more people. We know a lot about what works in healthcare to improve quality, to reduce costs, to make it more customer friendly, but we've been competing in private companies with that, and it's been proprietary. And so we're really trying to, in this last chapter of my career, really wanting to make that available to anyone who wants to scale what works. And so that's what our company is founded on. So I'll pause there and answer any questions you guys might have.
Cassandra, while people are thinking of questions, please feel free to put them in the chat. Where did you get the courage to start your own company? I mean, that's kind of a scary thing, isn't it? Leaving a secure paycheck.
Yes.
Obviously, you had the expertise, but where did the courage and the desire come from to go out on your own? And how's it
Yeah,
gone for you?
people had told me for years you should run your own company. And I just hadn't absorbed that internally very deeply, right? I was like, what the heck would I sell? I didn't invent anything, I don't, I was thinking like I had to like have a product to sell. And eventually I realized after working in a lot of places and learning so much, and after you go into several companies, that's why I'm not really against job like company hopping, is because I got to see how things worked in a lot of different places. And so then it built up a confidence of, oh no, I do know how to run this. I do know how to fix it. I know how to fix it in different circumstances. And then I finally realized I'm the product. And that took a long time to do. And then the courage I think came from, and I'm also a very good financial saver. So we didn't grow up with a lot of money, and so I save money like a squirrel. And so so whatever you do, save and figure out how to save. And I had to find these tricks to save. And so eventually, like, I felt like I finally felt somewhat secure, and that I could figure out worst come to worst. I could take it out of my savings, which is like anathema to me. But, so I had done that for myself. But then honestly, my best friend died, and last year, and um, forgive me if I get like emotional about this because she was my best friend for 40 years from Provo, Utah, and uh, we were like kind of a ridiculous pair, and we were always getting into trouble. And I think that's where a lot of my bravery came from in life. When I moved to Boston, she came with me to go to Boston, not my parents. She's the one that tucked me into the dorm, and so there was this really wonderful blessing of having someone just believe in you wholeheartedly. And until she passed, I sort of didn't know what a gift I had been given. And so when I would see, as we grew up and we stopped doing like ridiculous things and we were doing, you know, philanthropic things, or we were doing, career things and more serious things, we kept this idea of like nothing's ridiculous. Like all the ideas are not ridiculous. And she used to say to me, well, someone's going to have to do that. Why not you? Why shouldn't it be you? Like someone will do that job. Someone's going to also come up with this idea. Why shouldn't it be you? Why not you? And so I've been trying to live up to that, like more and more.
That's amazing. I'm sorry about your friend. That's always hard to lose somebody close to you. We've got questions coming in, which is great. So Gary, thank you for asking this. He said, "What were the pros and cons of working for Aetna? Aetna is in trouble here in Utah, and I didn't realize that. So you want to
Like
comment on
legal
that?
trouble? Like, is there a lawsuit or something going on?
I don't know if it's
Or just economically?
I think it's both. Um, they they're a huge insurance company, and they've been caught not being too uh, on the up and up, and so a lot of medical providers are refusing to. Uh, Utah's choosing not to bother carrying them now, as far as the
Yeah.
state is concerned.
Yeah, it's interesting. So when I first went to Aetna, I worked in network, which is the provider contracting piece. And I worked in a special part of the network area that was around collaborating with providers. And so we would co-invest in like care management teams together, or Aetna would embed people into their care teams. And so I was kind of in this really cool innovation unit. I would say the pros working there was that from a safety perspective, I got to do innovation with the safety of large corporation funding it so that I could try things. And, if I was trying a program for $100,000 and measuring it, that was a drop in the bucket at Aetna, and nobody bothered me. And so I got to try a lot of innovative models, and a lot of them work. I would say the cons of working at Aetna were um, there was this tension between the local markets and the national office. And so, I think anytime a company gets that big, they may not understand how important that particular provider is in that locality versus someone looking at a spreadsheet here in Hartford, right? Um, and so that was always a tension that was happening. Um, I think I was also there during the CVS Aetna merger. I'm actually teaching a class in October on the Aetna CVS merger and whether or not vertical integration works in healthcare. And that was incredibly challenging times during that merger. So that's essentially between that and the pandemic is why I left Aetna. It was too stressful to work there anymore. But they also suffered a little bit from shiny object syndrome. So um, uh, when you're a company that's that big and you impact that many lives, you really need a solid long-term strategy. And to the outside world, they may have that with CVS. Inside Aetna, they did not. That was not there. And they would invest in one thing and they were looking for returns within, let's say, 6 months. And CVS as a retailer made that worse because they're used to retail data coming in. And is any of you guys working in clinical services, or I saw someone who's working with like government agencies, healthcare outcomes are measured over 12, 18 months, 2 years. And so you can get leading indicators, but you cannot have shiny object syndrome and work in healthcare, is my point of view. And then also after I left Aetna, I sort of vowed never to work at a healthcare company that was traded on the stock market again, because you cannot escape the pressure of third quarter earnings. You cannot escape the pressure of fourth quarter earnings. And my literal job was to do clinical innovation and prove that it worked or not. And so I had the backwards math when they would cut programs, how many people they were hurting. And I couldn't take it, that we would do that for stock market, and it's not limited to Aetna. It's really anyone who has those stock market pressures.
Yeah, for sure. Interesting. Well, thank you. We got a question from Joan. What was your biggest fail and what did you learn from it?
Um, My biggest, they ask these at interviews, and you would think that I would have this off the tip of my tongue. Um, you know, I think early in my career, I wasn't as attuned to my communication style as I was later in my career. Yeah, rollerblading near cars. Yeah, I would also say that it's self-care. So, I think, early in my career, because I'm a results-oriented person, I'm a data-driven person, even though I'm loving, I didn't bring my full self to work. And so no one got this maternal caring part of my personality at work. And it was sort of like later in my career that I understood that that was okay and that I felt more confident that that served me at work, that my team was getting an authentic leader who truly cared about them. And so I think I was more direct, more harsh in my communication earlier in my career. And then later in my career, I really discovered that you get so many more results through kind leadership. It really became a strong part of my leadership. And when I left AmeriHealth Caritas, my last role, I had maybe 1,000 people that were working for me. And, I would do day in the lives with them. I knew what they were doing on a daily basis. I knew their families. I knew what was going on in each. We had 10 states. I knew what was going on in each state that they cared about. And I integrated that more into my leadership style of coffees with Cassandra, where the team could tell me anything and they would tell me things, and it was super helpful. So I think I underappreciated that and probably suffered from that early in my career. And since you guys are a little bit older and wiser, like that is a kryptonite to get through a lot of crises, problems, transformation, downturns in the company, that you're older and wiser and more attuned to your own emotions and your team's emotions. Um, yeah, and then I would just say about the self-care, as I became sort of more established in my leadership, and I tell this to anyone who works for me, self-care is a must in leadership. It becomes not a nice to have. This whole work-life balance discussion that happens. Your self-management is actually partly what you're getting paid for as a top leader in these companies, that you can be calm, self-regulate your emotions, help regulate other people's emotions, think clearly in crisis. So if you are exercising, eating healthy, watching your blood pressure, that's actually part of your leadership job. So that was something that I had to figure out in my career too.
Yeah. I love it that you're so self-aware. We're going to do a quick poll before we get to some of these other questions. I would like to hear your opinion. What's the biggest challenge with our healthcare system today in the US? So if you would throw that in there, we're going to see if Sandra can respond. We're going to try and get to all these questions. So, uh, wow, there's a big, big question there. Oh, cost. Amy said cost. Okay. Anybody else? What would you say is the biggest challenge for the healthcare in this US today? We're going to see if Cassandra can solve that problem for us. Integrity. Oh, that's interesting. Purpose versus objective, lack of bedside manner, availability of timely care.
Mhm.
Interesting. Not preventing disease, just treating it and not treating people. Prescription drug costs. Completely agree with that. My thing is, having moved a few places, is like healthcare records. Like just like why can't we fix that where I don't have to educate my new physician once I move, like on everything and getting records transferred. I would love to see someone solve that problem. So, okay, that's great. Thank you for sharing your opinions. Let's go to David. David says, I'm interested in pursuing a career in healthcare administration. What does a typical day look like? Manage like an emergency department, and what would you give someone starting out in that field? How do they break into healthcare administration?
Um, well, I would say a lot of healthcare is I mean, there's an element of who you know, and I will just say that because it's quite a small community, and so I would do your education. Education is highly prized in healthcare because who you work with is educated as well. So I think finishing up, someone asked, is a certificate worth it? Any education is worth it, and so especially in healthcare. So do what you can. And then also there's like continuing education certificates you can get, that's even prized, or like the fellowship of the ACHE. There's courses that you can take online. So just always continuously learning. That's very highly prized in healthcare. So, but just get started at a hospital. So, they gave this 26-year-old an entire department. But why did they give me a department? Because I had shown up in this other job time and time again, shown I was a good teammate, shown I turned in my deliverables, shown I cared about the hospital, right? I had showed up and was a a really good team member who was smart and always learning, and I saw a problem and I went to solve it. I didn't complain about the problem. That's another one. So I would say get your foot in the door, however you can get your foot in the door, show up as a good teammate, always look outside your own department and your own role, offer help, Everybody's helpers in healthcare, so they will resonate with that value congruence too. So literally just get your foot in the door and do a good job, and that's how people rise up. The people I was a financial analyst with in Boston are like COOs of hospitals there now. It's mind-boggling because they just promote within, they do a lot of internal promotion.
Yeah, that's great advice. I also recommend finding somebody who's doing what you want to do, that you have something in common with. Maybe you're from the same area, went to the same school, do a 15-minute informational interview and just pick their brain on their career.
Yeah.
And that starts a relationship. You learn, but it may continue on if you hit it off. So that's great advice.
The other thing I did early on, someone gave me the advice to always look 2 steps ahead in your career, not one, and then download that job description and see what you have to do. Like, what would you have to do to have that job? And then do a true analysis and say, do I have these skills? And then how would I learn these skills? And that helped me, I think, figuring out MBA versus MPH. That helped me with career progression. And I would Google job descriptions and see what it required like all the time.
That's great. Yeah, and yeah, LinkedIn I think is a great resource.
Well, and you
Um,
guys have AI now. I didn't have AI. It was Cassandra. So you can literally take a job description and your resume now, and believe me, everyone's going to do this because this is how the resume sort of filters work at companies too. They're going to knock your resume up against the job description, and then you can ask Claude or whoever, what am I missing, right? Like, or like, am I a good candidate for this position? What else would I have to have? Or what would be a good candidate for this position? You can either update your resume if you're not describing it well, like that skill, or go seek and fill that gap and just be open to that honest feedback about yourself. And it's a
yeah,
machine now. It's not like a person telling you anymore.
yeah. Yeah, and make sure it's authentic, whatever you're putting in the resume.
That's
Good point.
right.
I do want to explore a little more with healthcare and AI, but before we do that, we've got a question from Natasha about how is being a mom and having a career. How did you balance both things? You've got kids and you've started your own business and you've had a high-powered career. How did you make that work?
There's a few things that have, first of all, being a mom makes you so much better at your work. I talk to a lot of women who are very concerned to have children and, whether that's going to impact their career. It makes you sharper. It makes you can multitask. You get things done on time because you're getting out of there. You're getting home to your kids. I always say hire a mom because they will get it done. So I love hiring moms. And I love helping women go through that phase of their life where they adapt too. But I mean, there's a couple of tried and true things that people help me with that I've put into practice. So, and it was literally something like this. I talked to a CEO and I asked the same question. And one of the things she told me was never be somewhere where you don't add value. And so she's like, if it's your work or your kids, like be in one of those places, right? Or whatever it is. She's like, so don't do a long commute. Set your life up that she lived next door to her kids' school. So she could pop over for like school meetings and stuff like that. I was like, wow, that's amazing. And so like just thinking intentionally, like being in your car that has no value. You're gonna be mad, that you're just not in either place. And then obviously sorry guys, but like for the women, it matters so incredibly who you marry. The number one like impact to your career is who you marry. Because it's about who the dad is at home and whether how much they want that part too. So my husband, one of the reasons I married him is the way he described wanting to be a dad, like the way he described he wanted to be a hands-on dad. And I knew to have a career, I needed someone as interested in being a parent as I was interested in having a career so that we were completely exchangeable in some ways. And we've been able to do that. So we live in West Hartford and we have 2 very successful careers. He's COO of a healthcare company. And we've never moved our kids. And that was something we agreed upon is that we would never move our kids because we knew we would end up tit for tatting the career and saying, oh, now we moved for you. Now it's time to move for me. And the person who would pay would be our kids. So it's up to us. So we do allow travel in our jobs and stuff. It's up to us to find a job that we like and furthers our career, but not at the expense of the kids. And so there's a couple of like rules we put in place that have worked out. So for me, it's your spouse, how they support you, your childcare that is super reliable. You don't underestimate how much childcare support and that that's okay. And that your boss and that you have a good boss who like likes what you bring to work, as being a parent. And that's true for the dads too. Like you don't want a boss that pretends you don't have kids at home.
Yeah. That's really excellent advice. That's going on social media, Cassandra. And then you're going to have to write a book about it. So, we've got a long question from Becca. She said she's always looking for ways to learn, or she likes how you look to learn different ways from your job. She said, do you have any advice for people who are happy in the roles but look to improve in their careers either intentionally or elsewhere? You kind of answered that with the two steps ahead. Another question is I have is do you see good value in earning a healthcare administration grad certificate?
Yeah, always any stamp of quality. I always look for breadcrumbs of quality on my resume. Like, did you get invited to speak somewhere? Did you go the extra mile and like write up the thing so you could present a poster somewhere? You'd be shocked how many times I just like submitted something and just put away my fear of rejection and just submit it, and how many times I've been accepted. And honestly, I think a lot of it is just trying. And yeah, I do a lot of, you can go on my website, I do a lot of writing. So I do like writing, but uh it was extra work after my kids went to bed. It was extra work, but it also fulfilled me to be able to speak my mind or, go to these conferences or meet people and like what you're saying, Tad, like meet all these people and learn about like what do they know, have these great conversations. And now that I have my own company, it's very validating that all these relationships that I just kept up, not out of interest, not out of self-interest over the years, but out of really being curious about other people and what they were doing, how much it really helps my company because they love working with me, right? And so that's who you want to work with. I didn't understand fully how important that was going to be.
Yeah. So before we get to some of the other questions, I really would like to talk about AI in healthcare. I think there's a lot of fear now that AI is going to take my job. Where do you see the role of AI in healthcare administration? Is it a danger to someone's job? I'm assuming like billing and other areas of care could be threatened. How do you see that in the industry? And then how do you, I guess you can never fully protect yourself, but how do you embrace AI and make it a plus rather than something we're afraid of if we're moving into healthcare?
Yeah, I think there's less concern about AI taking your job than someone who knows AI taking your job. So, like beating you out of a job. So, you have to get to know AI. I love Claude. I went through and just, I went on LinkedIn and people are writing like use this for this, use this for like all the different like self tools. And I just tried them. I downloaded them. I used my big girl dollars and I paid the $15 and tried them out, and you know what? I like Claude. I also like that Claude is a company that's teaching Claude to have a soul and that someone's job is to do that. I just think that's really cool. So but for the industry as a whole, now we've been using AI and machine learning for a very long time behind the scenes in healthcare. I think people don't realize it. So on the managed care side, I've been using machine learning AI for predictive algorithms to predict any individual's health on a daily basis for 15 years now, so there's been elements of this that we've already been using. I think as it accelerates right now, what I'm seeing more than anything is that we haven't put guardrails on what to do with clinical AI. And so AI and like large language models are not the same as what you need in healthcare, right? And so, so for example, you can go and just do a chat GPT on like large language model and it just needs to know English. But if you're applying it in healthcare, it needs to know anatomy, physiology. It needs to be trained on clinical conversations. So the best AI that I'm seeing is that there's a really clear plan in how to train AI to almost the same way we train other professions within healthcare. So I look for that. Are you training on clinical, and I mean like millions of clinical conversations, like nurses talking to nurses, because the way AI works is within context, right? Frequency and context. And so you can't have like a grocery store conversation influencing, you know, um, how the transcription is going to happen in Epic, right? So there are some guardrails around that, how you're training it, what data you're using to train it. And then the other thing that I'm really looking for in AI right now is that that there's a good governance model on top of it. So that I did a lot of work in Medicare and Medicaid, and I do a lot of work in those spaces, and the states really want to see they're trying to get their heads around what you're doing for legal protection. And so for example, are you as a company protecting PHI and PII like you would a medical record company, right? Like, or is this um, particular model out on the cloud, and then PII and PHI can escape, right? So you have to make sure you have really strong governance, cybersecurity, thinking that's going into it, legal thinking that's going into it. So, I was part of the Center of Excellence at AmeriHealth, and we did a lot of thinking about what's the governance, when would we use it, when would we not, where does it have to be stored, so that we could honestly answer this back to the government that we were being careful, with our data. The other thing, if I think about like hospital operations, um, is that everything we do in clinical operations has to be efficient and it has to be substantive. It has to add value. So I'll give you an example. When I was at AmeriHealth, we were implementing Epic for our care managers. And so when we implemented Epic into the insurance company, they downloaded like 3 years of medical charts for our nurses to see. That is useless. That's just like a dump of data, right? But if you take a minute and instruct an agent to summarize based on some sort of like risk algorithm, what's the most important thing here that the nurse needs to know today? You can use AI to make efficient, but you have to plan that all the way through. And what I have found in healthcare operations is that to really do a true integration, to do an end-to-end system design, you have to co-create with the end users. You have to take all of the science about what's really going to be meaningful. You have to make it simple. You have to make it efficient. You cannot just add more work to the system. There's a lot of clunkiness in the system. So you got to get a little bit more elegant in your end-to-end design. And until people really do that, I don't think that healthcare operations will adopt it as much as it needs to because they have no bandwidth for burden and without meaning.
It's interesting. One thing I've learned is just how important the prompts are, right? Learning how to ask the right questions. So,
And
oh,
learning to ask it to validate itself. I
yeah,
ask, if I'm asking Claude to do research for me, I say, okay, output a graph for me that does da 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 da, and then also output it in Excel with all of your sources and data points separately, so that I can look and validate that they're still like viable sources,
yeah,
and I can go and look and see how they pulled that data and do a check myself.
yeah. You've got to check AI for sure. Yeah.
Yeah.
Um, Okay, we've got just a few minutes left, so I'm going to consolidate two questions and then we're going to probably have to wrap it up. But someone's asking about administrative fellowships and how effective are they in starting out of the industry? And then as someone who's looking to do that, what skills they may be in a program or looking to be in a program, what skills should they focus on when they're in the program that would help them be a viable administrator in healthcare?
Yeah, in the 90s when I was in Boston, the new CEO of Mass General Hospital was one of their administrative fellow grads. And she was probably 30 when she was CEO of Sally, I forget what her last name. But she came out of that administrative fellow program. And people ask the same question to me as chief of staff roles too. Because what these types of internships sort of get you is exposure to the top level of decision makers in any organization and how they think, what their top, concerns are, what they're working on, what they're paying attention to. So it's really good exposure. So I do think they're valuable, depending on your level of career and all of that, right? So it depends on the person and what you want to do, because they don't tend to pay well. But what makes you stand out? There's a few things. They're obviously going to look at the standard stuff. So the standard stuff like parity and experience and why you want to do that, that's all parity, right? What makes you stand out a lot of times is just in terms of how do you articulate your vision? How do you articulate why you want to do this? Can you articulate why you're a fit for now? Right. So right now, in health systems, we're talking a lot about rural health. Are you from rural areas? Can you connect that to your story? You have a passion for something that comes through so many times if you can figure out how to tell your story and sort of not be shy about it. I think sometimes people don't want to get too personal, but honestly, that's what comes through. Um, is your passion for that and why it's connected to like an industry trend that you're seeing, or what that institution's history is. That's a big one too, like CVS was originally a corner store pharmacy, and so like there's things that you can pull on there that will make you stand out, and that's who people look for.
Yeah, both the people skills and the technical skills. I think we focus so much on the technical, the AI, but communication with another human is always going to be needed. And how do you connect with them? So
Yeah.
I really like that. Well, we are out of time, Cassandra. I could go on for another couple of hours. This has been really, really interesting. I think you've done amazing things in your career. I love how you take a measured and balanced and values-based approach to your career. I think a lot of us could learn that. So
And just like not being shy, don't fear rejection, try it. Why
yeah,
not you?
yeah, exactly. Would you be comfortable if people wanted to connect with you on LinkedIn? Would that
Oh,
be all right?
sure. Yeah, absolutely.
Okay.
Always.
So you can find Cassandra Toscano on LinkedIn. So yeah, Cassandra, thank you so much for your time today. We appreciate it. Again, thank you for everyone who joined us today. Stay tuned for future Friday Career Connections in August. So have a great weekend and try and stay cool. It's going to be, at least in Utah, it's going to be hot. So I don't know about Connecticut.
I'll be in Maryland this weekend, so
Oh,
I want to be there.
hopefully at Deep Creek or somewhere fun. So
Yeah.
all
All
right.
right. Thanks,
Thanks
guys.
everybody.
Talk
Bye-bye.
soon. Bye-bye.